So this is the Baxter IV pump that we're going to be using in clinical and in the hospital. It's called the Spectrum IQ version. It's a smart pump, so it does a lot of things on its own, but certainly you have to check the settings to make sure that you are following the physician's orders. So I'm going to show you a little bit how to set that up. So you locate the IV pump. You're going to have a fully primed and ready to go primary tubing, which I have brought with me. We are going to, fully primed, yes. And using the dark blue clamp, which is called the slide clamp, that's going to be our first step. So that's going to go in the top of the pump, which is going to both open the door and turn the pump on. So in the top of the pump, there's a little slot. This will only go in one way, so if it doesn't go in the first time, just switch it around a little bit, turn it around. It's kind of like a puzzle piece. I'm going to push down, and my door will open. The pump will go through some presets, some setting checks, and when my numbers appear, then I'm ready to go. So there are 4 numbers that I have to get green check marks next to. The slide clamp in the top is number 1. Then I'm going to feed the tubing into this track, pushing 2, so I have a green check mark there. A little bit lower, I'm going to push on the 3 and the 4. Because it is a smart pump, it will tell you exactly what to do, so just follow the directions. So the next step would be to close the door. There are 2 little thumb grooves. Make sure that you push on both of them to get a good snap as the door closes. Next is telling me to open my roller clamp, which is down here, the light blue one. It's also telling me to open the slide clamp, which is the dark blue one. I'm going to open that. Next, it's going to ask me if this is a new patient. In this case, yes. So I'll select yes. I'll next have to select my care area, which unless we tell you otherwise, it's always going to be med-surg. You can scroll up or down accordingly, but usually it's med-surg, and see that's highlighted. In order to solidify that, I'm going to click OK. Next, I will be asked to type in the name of the drug that'll be infusing. All medications all IV fluids that have no drugs in them or additives are going to fall under the same heading of IV fluids plain. So I'm going to type that in the keypad. This is sort of like an old-fashioned how you would text. So for example, in order to get the I, I'm going to have to push the 3 button 3 times. Next, I'll go get the V, and I will push the 8 once. Once the pump thinks it knows what I'm going to select, it's going to give me some options. And like I said, this is IV fluids plain because it has no additives. So I'm going to scroll down to IV fluids plain, and I'll click OK. Next, I have to set up the rate of infusion and the volume to be infused. The rate will be whatever's in the physician's orders. So let's just say this is 75, but again, you're getting this from the orders. You're not making this up. Certainly click OK. If I scrolled back up, if I didn't click OK, that value would not save. So you would just go back to 0. So OK is your kind of like your enter button. Next is VTBI. That stands for volume to be infused, which essentially means how much fluid is in the bag that I'm hanging. Right now we have 100, so I'm going to type that in. I'm clicking OK. So now I should be ready to go. This is a great little tool to have as well. The smart pumps will alarm every 2 minutes if they are in an inactivity state. So if you are not quite ready to go, hit the hold button here, and it sort of puts it in standby. That way it doesn't alarm as you're getting ready and gathering your supplies and things to go into the patient's room. When you are ready to go, so now we're in the patient's room, we've done all our checks and all our identifiers. I'm going to follow the prompts on my screen, and it says push the stop button, which is this symbol, to start the pump. So I'm going to push that. It's going to ask me some questions. Are my clamps open? Yes. Here's 1. Here's 2. And the 3rd one is at the patient site. The tubing is not kinked because I've checked everything. And drops are flowing, which you'll be able to see in the drip chamber if it wasn't quite as full as it is right now. So I'm going to answer yes to all of those, and my primary infusion will begin to run. This is the IV fluids plain is what I selected as the type. That encompasses everything from lactated ringers to dextrose. Anything without additives or medications in it would fall under that heading. 75 milliliters an hour is what I input from the doctor's orders. And then if I would review my settings, I started at 100, so I'm infusing a little bit, and that's why that number is going down. The time will be automatically populated based on those calculations that I inputted. You don't have to type in anything for the time. And the last thing I want to show you is under volume given. That's a running total of the amount that the patient has received through the IV pump. So you don't need to, that's nothing that you need to input, and it's nothing that you need to clear until the end of the shift. And we would certainly help you with that. I'm going to stop this. Certainly get into the lab and practice with the pump. It's very user-friendly, but it does require you to not panic and to follow the steps in order to safely set the pump and be confident when you're at the bedside.